This bill expands the eligibility for GP care without charge on a phased basis and increases the gross medical card income limits for persons over the age of 70, which I very much welcome. And I just want to also take the opportunity to congratulate Minister Donnelly on his appointment to Cabinet. I know it's an extraordinarily difficult time for anybody working in the healthcare sector at the minute, and I'm sure that you will excel in this portfolio. We are counting on you, and I want to wish you very well. This is a welcome step for having a fairer and a more affordable care over the lifetime of this government. And it is essential that we continue to put provisions in place to ensure that there is care in the community and that it is at the heart of the provision of our healthcare service. Making the vast majority of healthcare services available in the home or close to home, rather than in our hospitals, I believe is the right step forward. And having care in the community would be of huge benefit to people in my own constituency of Cork East. During the COVID-19 pandemic, when we want to put as little pressure as possible on our hospitals, any step forward towards providing primary healthcare services makes sense now more than ever. And I hope that this is the first step forward in a pathway to developing community healthcare networks to support the expansion of services based on the need and the size of local populations. And I believe increasing the eligibility criteria, which is being done in this bill, will be very, very helpful in delivering that. Places like Youghal are vitally in need of primary healthcare centres, and it is not right that a town with a population of over 8,000 and many more living within the catchment area, and they've seen a population increase of nearly 9% between 2011 and 2016, far above the national average of 3.8%, still don't have access to primary healthcare services. And short-term emergency measures, I believe, will be very, very important until the government can put strategies in place to address shortfalls that exist, like in my hometown in Youghal. Something that came up repeatedly over the general election, Minister, was the lack of access to healthcare services for many new residents living in the East Cork area, where there's enormous pressure on the government to try and address that crisis. And I look forward to working with you on that matter. Minister, throughout recent times there has been a great deal of fear amongst people accessing their local health services and their local health centres and hospitals because of this pandemic, and it's an understandable fear, but I think it's important as well for individuals that we can put alternative arrangements in place, such as telemedicine, where they will be able to access medical professionals. As a country, we need to start to look at additional services that complement our healthcare services. The World Health Organization defines telemedicine as the delivery of healthcare services where distance is a critical factor by all healthcare professionals using information and communication technologies for the exchange of valid information for diagnosis, treatment and the prevention of disease and injuries, research and evaluation, and for the continued education of healthcare providers, all in the interest of advancing the health of individuals for their communities. And there's a huge potential for the application of this across our healthcare service, and it will go a long way to ensuring that all citizens of this country have access to medical services that they need. In the case of this pandemic, it will dramatically increase the accessibility and safety of care and reduce the use of individual protection equipment and allow doctors under quarantine to continue to work if they are in a position to do so by expanding the available human resources to our health service. It could also be used as a great training tool to ensure that our medical students continue to have access to medical education during the times of this pandemic. I suppose looking to the future, there are advantages of reduced travel costs for the patient, the increase in accessibility for individuals with mobility difficulties, and the potential to have the globalisation of medicine with the potential for obtaining expert opinions at great distance quickly via virtual means, which is hugely encouraging. Looking across East Cork, there is a huge level of research and development ongoing, and there is currently much talent and potential. Telemedicine aids in sharing of this expertise and ensure that it gets to the people that are most in need of it. And I know that there are some obstacles exist for telemedicine in the future, such as data privacy and confidentiality, but I think it would be unwise of this House to not explore such complementary forms of medical provision, especially considering the COVID pandemic that we currently find ourselves in. I conclude with saying, Minister, that affordability is a vital issue when it comes to the healthcare provision, and I recognise the good work that has been put forward in this bill, Ceann Comhairle. But as I was saying earlier on, I think we need to look at areas such as East Cork, where I'm here representing, that there are problem areas for people who are trying to access healthcare services, as well as the issue of affordability. I just want to conclude by saying I wish you all the best, and I look forward to working with you.
Thank you very much, Deputy O'Connor.